Happy New Year from Dr. Brian McKay, not just a chiropractor, Stanford, Darien, Norwalk, and New Canaan. Lovely title. Well, I'm going to talk to you today about headaches because you know what? 2025 is going to be the year about getting people's headaches to go away. Yes, go away naturally. Let's put the caveat naturally. Not promoting medications that typically don't work, overload the system, ones that cause rebound headaches. So you know how many headaches come about because people are taking too many medications? It would shock you, and it should. But let's go into different types of headaches. We'll talk about a TAC, a TAC. And you say, what the heck is a TAC? Well, it's a type of headache that begins in what we call the superior salivatory nucleus, which is in the brainstem. A lot of times I'm going to tell you about the different headaches that come about in the brainstem. All right, the brainstem is where you produce a lot of neurotransmitters, and tension in there will contribute to headaches. But the one we're going to talk about today is one trigeminal autonomic cephalgia, TACS. Cephalgias, okay? So it's again, trigeminal autonomic cephalgias. Cephalgia is a fancy term for headache. Autonomic is for the autonomic nervous system, which is comprised of the sympathetic and parasympathetic. We want a balance between those two nervous systems, like the yin and the yang. It's basically the same thing, easy to understand. I think the yin and the yang, the sympathetic versus parasympathetic. But trigeminal relates to the trigeminal nerve. And we have involvement with trigeminal nerve quite often with headaches. It's a big reason we have people with headaches. It's also one of the big reasons why we here at Core Health and Darien get people better because we fix these type of headaches. So the trigeminal autonomic cephalgia is involved with the parasympathetic part of the autonomic nervous system and its outflow and cranial autonomic reflexes. And here's how it's connected. Well, the first thing is the superior salivatory nucleus. You think mucus or something. So basically, during headaches with TAC, okay, or trigeminal autonomic cephalgia, you're going to see tearing, runny nose, and facial flushing. And these are the autonomic symptoms associated with many different types of headaches, but specifically here, cranial nerve 7, which is like facial nerve is 7. The trigeminal is 5. So what happens is the superior salivatory nucleus, located in the brainstem, is a key parasympathetic nucleus that contributes to cranial autonomic functions. It innervates the lacrimal glands, nasal mucosa, and other cranial structure via the facial nerve. Okay, its branches, including the greater petrosal nerve, which you really don't need to know, but it also can be confusing because during headaches, like cluster headaches and migraines, parasympathetic activation of the superior salivatory nucleus can lead to the thing I said, tearing, runny nose, and facial flushing. So the superior salivatory nucleus is also involved in many headache disorders, okay? Trigeminal is cranial nerve 5. Before I messed up, I said 7, but that's on me. And it carries pain signals from the blood vessels and the duromata to the brainstem. I believe a lot of the headaches we get is irritation of the duromata and the blood vessels. And so what happens is this superior salivatory nucleus is a mechanism for passing these nociceptive, which is the pain signals, onto. So if you can minimize the pain signal, you can minimize the headache, especially the ones that affect what we call the duromata. The duromata is part of a covering on your spinal cord and your brain. It's one of the 3 parts, the duromata, the piomata, and the arachnoid space. It's this dense covering that covers your whole brain all the way down to your low back. So when you have increased parasympathetic outflow from the superior salivatory nucleus, you can exacerbate headache symptoms via vasodilation and increased secretions. All right, so the vasodilation is associated with migraines and, trigeminal autonomic cephalgia is a hallmark feature of headaches. Okay, dysregulation of the superior salivatory nucleus may perpetuate these vascular changes, making the headaches more intense. Also, let's just call, instead of the superior salivatory nucleus, let's just call it the SSN. Once again, let's say superior salivatory nucleus, aka the SSN. And what happens is it can stimulate neuropeptide release, and this can increase its parasympathetic connections, which is something we don't want to do. Okay. All right. Clinical implications. Dysregulated superior SSN activity explains partially why the autonomic features and the vascular phenomena seen in some headaches. So by treating headaches and taking pressure off the brainstem, as we do here at Core Health in Darien, that's how we go about treating headaches. All right. I know I just threw a lot of terms at you, but it's just a type of headache: trigeminal autonomic cephalgia. Again, SSN, superior salivatory nucleus, located in the brainstem. The reason we get most of the headaches better, I think, around here is because how we focus on basically the brainstem as causation. I'm Dr. Brian McKay. It is the 3rd of January, 2025, the year of headaches being gone. You got a question on headaches, feel free to give me a call. More than happy to refer you to someone in your area because I'm in Darien, Connecticut. We can be reached at 203-656-3636. 203-656-3636. Listen, have a great new year, and especially have a better new year if you don't have any more headaches. All right, thanks very much for listening. Have a great one. Thank you.